and I love to educate. I'm a dork myself. Like, I love to learn. I absolutely love to learn. There's not a day that I don't learn something or want to improve on my skills or my knowledge base. And I think that that's what makes me a good educator is people see my passion for learning, and hopefully that's infectious.
Hello, and welcome to the Art of Emergency Nursing podcast. This is where we share stories for inspiration, entertainment, and encouragement, because we all know emergency nurses have the best stories. Now here's your host, Kevin McFarland.
Hey everybody, Kevin McFarland here, and welcome back to the Art of Emergency Nursing. This week's guest is someone who I'd love to follow on social. She's an ED nurse and an educator. She's the kind of educator that your hospital educators want to be when they grow up. She's passionate about evidence-based practice. She's passionate about free open access medical education. And she has more certifications than most of the people you know. She's one of few people to have all 5 BCEN certifications. My guest this week is the brilliant Gina Carbino. Enjoy the podcast.
Well, my name is Gina Carbino, and I currently work for Champlain Valley Physicians Hospital as a clinical education manager in the emergency department. My entire background has been in the emergency department. I'm one of those rare breeds that started in the emergency department. And from there, I really got passionate about education. And so I moved from the bedside role into an education role, and I love it.
How long were you at the bedside?
About 12 years.
Okay, that's a good long time.
Yeah. And I still put my scrubs on and my sneakers on and get down there when I can.
I bet you do. How long have you been in education?
I have been in education probably 5 to 6 years.
Okay. All right. So as an educator, what has your attention right now?
So, I just started in my new role, and about half of my staff has been a nurse under 2 years. So that is consuming a lot of my time right now. And of course, I have a side gig where I teach certification review courses. So between those two, that takes pretty much all of my free time.
I bet. So what education differences are there in the 2-year or less nurse versus the more experienced nurse? How do you change up your education, how you deliver your education to each of those groups?
So there's definitely differences in generational differences. For sure, I definitely see that. But I think that if you are a great educator and you can adapt to those needs, you don't need so much to change up the way you deliver stuff. Because if you can deliver stuff on multiple formats, which I think is best for type A personalities that tend to flock to the ER, then you're okay. So for example, if I'm rolling some type of education out, like we had a request for education on bladder scanners. So side by side, grab the bladder scanner, just do a quick 1 to 2 minute, this is how the bladder scanner works, and sort of round in the department. Then send an email out of just some key points. Post it on social media, on our Facebook group, some key points. Do an audio recording. Put a laminated card on the bladder scanner with a QR code that they can scan, and just something that's short, little tiny bites of information that's digestible, 1 or 2 minutes where they can watch a video of one of our staff members using that piece of equipment. I think that gets everybody. So if you're willing to put in the time to make it bite-sized information in a lot of different venues, I think that covers everybody, from the nurse that's been here 35 years, who pretty much knows it all, but just needs a little bit of a refresher on how do I do that? Brand new nurse who's never used that piece of equipment before. If you're willing to break it up, I think it will be successful.
Your emergency department has a social media page for education?
It does, yes. It's a private group. Yep. Mm-hmm.
That's amazing. That's
for
a
education
great
or
idea.
whatever.
Oh, yeah.
Yeah. Oh, it's so successful. I reach more people on our Facebook page than I do via our in-house email, for sure.
How funny is that? So I mean, it really is becoming the, instead of the bathroom wall where you'd post things on the bathroom wall, which you probably still do that anyway, Now they're checking the work Facebook page. How funny is that?
But it's a reality.
Yeah.
It's definitely a reality. If I surveyed my staff on if I rule something out, where did you see it? Our Facebook page is going to be the number one answer.
That's funny. That's
it shouldn't.
It's very forward thinking. It's very forward thinking, and it really is shows the adaptability. I think you posted the quote from John Politis that basically said, it kind of basically said, hey, forget about complaining about what this new generation is doing and meet them where they are.
Yeah, absolutely.
And I was like, that it's absolutely true. That's what you have to do. That's what you have to do as an educator.
But I don't think it's also accessibility, right? There's all of these barriers in place to traditional learning in a hospital setting, right? We have legal and we have our IRB board, and there's a necessity for all of those departments, but they produce these barriers that I feel are a little bit overwhelming to the staff member who just wants to sign on to their email and get some information. But the barriers that we need to go to just sign on to an organizational email is stressful when you can just open up Facebook and bam, there's access to whatever you need. Yeah. So I don't really necessarily think that it is reaching new folks because I'm not the youngest cat out there, but I love social media.
Yeah.
So I don't think it's a new nurse thing. I think it is the sign of the times, just accessibility.
Absolutely. And I think you're absolutely right. Now, you mentioned you teach certification reviews as well. What all certification reviews do you teach?
So any of the BCEN certifications and also CCRN and PCCN, and I do that in conjunction with my buddy Pam Hartley.
Nice. Now, what's your favorite certification review class to teach?
Well, trauma, of course, because aren't we all trauma junkies?
Wow.
And CCRN, because that is more in depth with like hemodynamics and electrophysiology, and I am truly a geek at heart.
Gotcha. I think and one of the things I'll mention in the podcast in the notes is I'll mention to follow you on social because you post some really great stuff and some of your notes are just amazing. Like I want you to write a book. Like I want you to take all your stuff and write a book. I think that'd be amazing.
You are not the first person who's suggested that.
It'd be such an incredible time suck, and it would be so much work. But if you did a handwritten CEN review notes, oh my God, those would be amazing. So just planting that seed for later, for some time. Yeah, okay. in all your free time.
Yeah. What's that?
Yeah, exactly. So what made you decide to get into nursing?
Well, I worked for a pharmaceutical company, and I just had some nurses in my life, in my family, and it just drew me. Nursing just always was a draw to me. And I hate to say that I fell into it, but I just sort of fell into it in school. I didn't start off as a nursing major. And I started taking some anatomy and physiology. I fell in love with that and ended up transferring my major to nursing and never looked back. Not a day have I regretted being a nurse. I love it. It's part of my identity. And I think a lot of nurses, it's not just a job. If you're a nurse, you identify as a nurse. And I think that's very unique about our profession.
I think you're right. It does become a big part of our identity.
Yeah.
So it becomes kind of who you are. I mean, you're even if you lost your nursing license tomorrow, you'd still feel like a nurse.
Yeah, absolutely. So I've been doing a lot of research on nurse serial killers, and in that research, I'm looking at like second victim syndrome. So nurses that make medical errors and end up having patient harm or patient death because of it, and then they end up committing suicide. And I think that really speaks volumes on how much we identify as a nurse, that when we make such a grave error that it causes patient harm or patient death, that we can't cope with that mistake or with that identity issue.
Yeah, it's bad enough when you make a minor issue, a minor mistake, but when you make a major mistake, holy smokes, that's just gotta wreck you. I mean, I remember, I've made medical errors or made med errors where I was like, oh my God, this is going to be so bad. And it was nothing compared to what, some of the stories I've heard. So.
Right. And I think that with that said, everybody, of course you've made medical errors. Everybody has made errors. We are human. And we need to move away from that culture of punishing or penalizing errors, because errors occur. They're going to occur, and it's generally a systems problem. Nobody goes to work and says, well, I just don't care if I make errors. We are very passionate about what we do as nurses. And I think we need to speak more about the systems problems that make the errors allowable to occur.
Absolutely. Some of the safety systems that you can put in place that, the time that I get angry with people who make errors is when they do all these things and work around these safety systems. It's like, there are 3 things that if you would have just done them correctly, you wouldn't have made this mistake. And you worked hard to work around all 3 of those.
Right, exactly. You're working just as hard to get out of work than you are to just do it correctly and safely.
Right. And just do it right the first time and don't put the patient at risk.
And then the other side of this is we have all of these systems in place that are meant to make our jobs easier, and they don't necessarily do. And so instead of working around them or complaining about them, voice your concerns, join a committee in your hospital, and work on making those a solution and not a hindrance.
Yeah, absolutely. Like what are the solutions?
Right.
Come up with those. So.
Yeah, I'm really excited. It's nothing that I'm really interested in, but I'm curious and excited as nurses move into the IT role, how that's going to make our charting better, our electronic charting systems better. We need more nurses who have strong, great clinical skills in those roles. So when we chart, it's easy, because we all know it's not easy right now.
No. I don't know how many times I've looked at something and be like, okay, you had no nurses involved in designing this at all, because this just doesn't work.
Mm-hmm.
So
yeah. I hear that nurse IT role is one of a very fast growth role in the nursing profession. So I'm excited to see what the future will hold when we have these great clinical nurses moving into those roles, and how much easier they're going to make our lives. Yeah. So hurry up and get there, IT nurses.
Right. Do you see that as something that you might do yourself, or do you see?
No, that's nothing I'm interested in, but I am excited for the folks that are interested in it, and I hope that they get there soon.
Absolutely. Like I'm far too much of a people person to be that person, but I want to be involved. so because I'm a little bit of a tech nerd, but boy, I'm a people person first. So.
Yeah, I need to be with the people out there in the department, and I love to educate. I'm a dork myself. I love to learn. I absolutely love to learn. There's not a day that I don't learn something or want to improve on my skills or my knowledge base. And I think that that's what makes me a good educator, is people see my passion for learning, and hopefully that's infectious.
What part of teaching is what's your favorite part to teach? What's your favorite subject, topic, process?
Oh, for sure. Hands down, electrophysiology. I love electrophysiology or rhythms. They scare nurses away, especially ER nurses. We really are bad with rhythms. And we just put up a wall And their rhythms, if they're broken down, electrophysiology, if it's broken down, simple, in a simple fashion, it's not that tricky to learn basic rhythms and how to identify them and some rules that go along with it. And when the light bulbs come on to some ER nurses on blocks or different types of rhythms, that really gets me going. That gets me super excited.
Yeah. What part of teaching, so if you're teaching, like, say, a CEN review, like, what's the part that you're like, oh, God, now we got to cover this topic because I am not feeling great about this topic? What's your
endocrinology.
Endocrinology?
Endocrinology.
Yeah,
yes,
you're like,
I hate endocrinology.
Yeah.
Yeah, electrolytes and renal stuff. Yeah, not my favorite.
Yeah, I'm with you there. Like, that's always one that I'm like, all right, let's get through this. You're like, okay, let's just do this. So you're like, it's not gonna go away. I've tried, but let's go.
Exactly. Yes, we can't get around this. There's not a workaround, so we're gonna have to think through this.
Yeah.
It's exciting. Like I've had some nurses that come to the ER from dialysis, and they get a bad rap, dialysis nurses, but they really have such a great understanding of electrolytes and fluid movements and fluid shifts that they're a powerhouse of knowledge. They definitely enhance the ER team.
God bless them for it too. Holy cow.
That's right, exactly.
So tell me, we talked a little bit about errors. Tell me about the first error that you made, or the first medication error that you made. Do you remember it?
First medication error, I sure do, yes. And it was right in front of one of my most favorite emergency physicians, Dr. Karate. I was a brand new ER. I started in the ER, so I'm a brand new nurse. We have this patient who is intubated, sedated, was a drug overdose, and I had to push charcoal down an OG tube. And I am so excited. Like, this is a big deal for me. I am a big girl today. I have this critical patient. I am pushing charcoal down an OG tube. Like, could it get any better? And, well, those of you who push charcoal down an NG tube or OG tube, gastric tube, understand how difficult of a push that is. So I'm focusing on pushing the charcoal, and I'm giving it my all. And so I'm not looking at the placement of the OG tube, which is dislodged, and the patient's mouth is filling up with charcoal. And the physician comes in and is like, can somebody please get like a real nurse in here to help this nurse out?
Ouch.
An inch high, we suctioned the patient's mouth out. Everything was fine. There was no, thank goodness, there was no negative patient outcomes from the incident. But it did help me realize that, I needed to slow down, right? I needed to slow down in my nursing care and not get so excited, and also not be so task-oriented. That was one of those moments that when I drove home and thought about, of course, I was bummed out. I made a mistake. I was bummed out, and I really wanted to review in my mind what had happened. My takeaway was not to be so task-oriented, and I think that as newer nurses, we focus on these small little bite clinical skills. And yes, you need to get those clinical skills down. That will come in time, but that does not make you a great nurse.
Agreed. I think as a new nurse, it's easy to focus on that stuff because it's more definitive. It's more like, okay, I now know how to do an NG tube. I now know this skill, instead of saying, okay, but why are you doing this skill? Because that's really, to me, that makes the difference between a nurse and someone who's just performing the task. Because anybody can perform a task.
Absolutely. And that's one of the things that I try to instill in all of the new nurses is ask yourself why you are doing this, because maybe this is not what you should be doing.
Yeah.
Always, why am I giving this medication? Does it make sense that I'm giving this medication, this amount, this route? Does it make sense that I'm doing this procedure this way? Always ask yourself why, and don't be afraid to ask another nurse or a physician, a part of your team members, should I be doing this? Because we have to get in that culture of asking why.
Absolutely. I remember when I was a tech in the emergency department. I was a tech for a long time in the emergency department before I became a nurse. And I remember as a tech being a little bit cocky and being a little bit like, oh, I got this. This is easy. I do everything the nurses do. I do all the same stuff because we did do all the same skills. We did NGs, Foleys, IVs, lab draws, EKGs. We did suturing. We did wound care. We did all that stuff. And I remember thinking to myself, like, oh, I'm already doing everything the nurses do already anyway. But what I'd never really appreciated, and there's a nurse that I'm going to interview on the podcast sometime that would remind me. He's like, Kevin, just because you're a tech and you know how to do all this stuff, do you know the why? Do you know the pathophysiology of why you're doing it, how you're doing it, what impact it's going to make, and what are the bad things that can happen? And even as a tech and an experienced tech, I didn't know all that stuff. And then I realized once I became a nurse, I'm like going, holy crap, there's a lot more to know than I would have ever thought.
It's not just the clinical skills. There's different like pockets that make you an amazing nurse. Clinical skills is definitely a good component. I want to work with somebody that has strong clinical skills, but I also want somebody who is a good critical thinker, who asks why, who's willing to stop me and say, Gina, why are you doing that? That, to catch me in an error. To also, and in part also have that art and spirituality. That's such a big component to nursing.
Absolutely. So, and it's one of those things that to me, that's what makes a difference in a nurse.
That's what makes having all of those components is what makes those nurses that when you start off in nursing, you're like, I want to be just like that nurse one day. Those nurses have it all.
Yeah. Who was that nurse for you? Like who was the nurse that when you were a brand new nurse, you were like, oh my God, this person's amazing?
Amanda Sipes. So she's still kicking it as an ER nurse in South Carolina. So shout out to Amanda. But working with her, she was my charge nurse when I started as a new nurse, and she was just a package deal. Like, never got involved in any of the drama or the politics that were going on in the department, had amazing clinical skills, treated every single patient the same. And this is definitely my most passionate takeaway from her is she didn't care if you were a homeless, dirty mess that came in because you had too much to drink, or you were the senator's sister. She treated every single patient the same way with dignity and respect. And if I one day am half the nurse that she is, I will be happy.
That's awesome. It's funny how those nurses, and they may not even realize that they're shaping your career, but they shape your career just with their presence and just how they do what they do. And just watching them, you realize that you're like, wow, I want to be like this person. Or sometimes you realize, okay, I don't want to be like this person. But it's amazing when you find those people that you can then emulate and say, okay, I'm gonna be like this person.
Right. And then and I have to, of course, shout out to Pam Bartley, because she is who inspired me to take it from the side to education and saw those qualities in me. Hey, Gina, the way that you speak and can engage people is amazing. And it's a quality that you have that I don't think that you see in yourself, and you need to do something with that. And she has always been like my number one fan and advocate to push me into some things that I would never have done without her. So I definitely, Pam Bartley is another person who has inspired me in my career for sure.
I bet that's really cool to hear. What was it like that first time you got up in front of a class and had to say, okay, here we go. I'm going to teach you about whatever. What was it like that first time?
So it wasn't necessarily a class that threw me for a loop. I hadn't been a nursing educator very long before I got accepted to speak at National ENA conference, which again, Pam had said, Gina, it was on FOAMed, free open access medical education.
I seen that lecture.
And I was an avid film consumer, and it really hadn't hit like the mainstream at that point. It was like sort of like a trending topic. And Pam said, Gina, you are one of the nurses who is an expert on this. Submit to talk. You never know. And I'm like, no, I'm nobody. I'm just, I'm just a regular girl. There's no way they're ever going to pick me to speak. Well, sure enough, they chose that topic. Certainly not me, but the topic. And I had to get up in front of a room full of people at a national conference and lecture. And yeah, that was super, super intimidating.
I bet it was.
Sure.
I bet it was. And that's a hard place to have be one of your first clinical presentations. Holy cow.
Yes, it was, but sort of just like starting in the ER as a nurse, right? It was, well, here you go, sink or swim, girl.
Yeah, no kidding. I was in that lecture, and I thought you did a fantastic job with a topic that you're right, a lot of people didn't know about. So I remember,
thank you, I appreciate that.
I remember seeing you do that lecture, and you just owned the room. You just got up there and you were just like doing it, and you seemed so at ease and so comfortable that I was like, okay, she's done this before. So you had me fooled. So that's good.
Yeah. Well, good, because I was shaking in my boots.
I bet. I remember one of my first ENA conferences. I was getting ready to. Yeah, I'd spoken at conferences all over the place and on many different topics, but it was a little different being ENA and being in a room full of really smart peers and amazing people and that kind of stuff. And I remember my first time presenting at the ENA, and Lisa Wolf, who is an amazing educator, who's an amazing educator and an amazing speaker. Every time she'd speak, her rooms were just absolutely packed. She, just kind of slapped me on the arm. She goes, "Take a few deep breaths, puke if you need to, and get up on that stage."
Yeah.
I was like, "Thanks for the advice, pal. I appreciate that."
I'm sure you nailed it.
I did okay. I think I did okay. I didn't get booed off the stage or anything, but it's kind of funny. That conference, I did two. I think I did the first time I spoke at ENA. I did two topics, and one of them got great reviews, and the other one got pretty good reviews. It probably wasn't the best topic, but it got pretty good reviews. But there was one review that said that I was the worst speaker ever, and oh my God, did I just obsess over that one line? I was like, oh my God.
I was just going to ask you that. How do you handle that negative feedback as an educator, as a speaker? Because it doesn't matter how great you are, how much you practice, how great the topic is. There's going to be one or two comments that really are just like, wow, and kind of hit you right in the heart like an arrow. How do you handle that?
See, and that's exactly what happened with me. I like obsessed over this. Oh my God. And they put worst speaker ever. And I was like, okay, I was at the conference the whole week. And I'm like, clearly I wasn't the worst one. I was thinking to myself, well, you should have been in some of the rooms I was in, because I know I was better. I know I was better than so-and-so. But it's hard. It's hard to not focus on those, and it's a reminder to, okay, well, if there's something actionable, then be like, if you get a thing that says, oh, there's a typo, great, fix the typo. Real sorry, hey, no big deal. But when you have that kind of just cutting feedback, that what you got to realize is you're not going to please everybody. There's no way you can. And if the vast majority are good, then you're okay. And I remember one of the first reviews I did, where I did the full day review on my own, I got probably 80% great reviews, and I got a couple reviews that were like, he kind of grazed over some topics that were maybe a little bit more important than he made out to be. And I remember just being like, oh gosh, they hated me. And they didn't hate me. They were just like, hey, you just seemed like you kind of didn't cover this real well. So you take that and you say, okay, well, now I know I gotta go a little deeper here. But you try not to let your ego get too bruised.
Right. Right. Yeah, no, it's difficult. It's those, with me, it's those one or two comments that are almost like personal attacks. It's like, wow, really? And I have to say, I do spend a couple days like fixating on those comments and internalizing them and saying, how can I be better? Or is it me or is it them? And
Yeah.
sorting out that mess. It is a little bit of a bruise and it does hurt a little bit, but I think when you put yourself out there, it's going to happen and you just got to move on.
Yeah, I mean, it's one of those, and anyone who's brave enough to get up in front of a class for an hour, let alone 2 hours, 3 hours, 4 hours, 8 hours, that takes a lot of guts, takes a lot of confidence, and it takes a lot of work.
It does.
And I think
preparation is key.
I think most of the time, the audience is on your side, but there's some people that, you can go up there and, the reviews are kind of funny because when you do a CEN review or something like that, you're like, hey, let's cover the stages of shock. And people are like, oh, I know the stages of shock. And I'm like, yeah, that's why it's called a review. Welcome. So, you're
right.
Like,
yeah.
And I, sometimes preface this with, you may not hear something that's like, you may hear a few things that are new, but you may not hear like all of this shouldn't be new to you. Like if you're sitting there going, oh my God, this is all new and amazing, then this isn't the right class for you. Most of this stuff should be not new, but a refresher and a reminder of, hey, these are some things that are important that you might want to remember for the test.
And I think like we need to shift what we expect from an educator. I think traditionally people that were in education roles in the hospital or even in academia are not the best educators. They're super smart, they're super well educated, but they don't have the clinical background, which is a key component to making somebody, I believe, a key component to making somebody a great educator. And I see that shift with foam and definitely in medical education, where we're taking these great clinicians and we're teaching them how to be great educators. And I love that shift. And the other thing is, I think we need to understand what goes into being a great educator and what goes into putting on that 8-hour class. There's 40 to 80 hours of prep time.
At least. Yeah.
Yeah. And we need to appreciate that.
Yep. For sure. Because I think, it's overwhelming to, try to remember, 8 hours worth of material and your stories and here are the highlights and here are the important things I need to make sure that I say, and try to remember all that is sometimes difficult.
Yeah. Creating the content, creating the PowerPoints, creating the handout. Yeah. Creating all of the little tidbits that go with it, the supplemental material. Hey, we don't have time to cover this in class, but if this is something that you're weak on, here are a few links that will help you in this area. And to put on a comprehensive class like that is so time consuming.
Absolutely.
We need to respect that as nurses, especially ER nurses. We're really tough. We're a tough crowd to please.
Yeah.
And it's experienced ER nurses are even more difficult to break down that wall and get to them. And I think that shout out to our experienced ER nurses, just show some love for education. It's needed. We need that refresher every year.
Yep. Absolutely. And, even though you got years and years of experience, if you come in there expecting to maybe learn a little something, then you can learn a little something. But if you come in there, if you come in there with like the challenge and the chip on your shoulder, you're like, okay, baby, wow me. And you're like, I'm probably not going to wow you, but I'm going to teach you some stuff that maybe, might help your patient down the road. And that, if that's the case, wow, there you go.
Just a couple key points, takeaway home points of another way to look at something. Like every time I read a rhythm book, I learn something else about electrophysiology, or every time I teach ACLS or PALP, I learn something else about resuscitation, or another light bulb goes on where it ties it all together. And that's what makes us great nurses, when we can tie everything together.
Absolutely.
Like, oh, that's why we do that. That makes sense now.
Absolutely. If you can connect those dots, then you're making progress. Then you're like, okay, now you're getting somewhere. And
the other thing is, we are in such a system of fast-paced change. Like healthcare is so dynamic and fluid and always changing. We need to always be learning. I mean, what was best practice a year ago is no longer best practice now. And with the access to all of social media and phone, that knowledge transition is shortening to 6 months to a year. We're taking these great things in research, like, wow, this is really best practice. We're reproducing them, and that's becoming common practice within such a short time frame now.
Yep, exactly. It's like so rapid turning. It's just crazy. So
exciting, though. Super exciting time to be practicing.
It is an exciting time to be practicing as a nurse, and I think that's one of the things that, as an educator, if you can communicate that, then you're doing your job. If you're going to communicate the excitement of, dude, you guys get to take care of patients every day, and what an honor and privilege that is. And you get to do that, but the cost of doing that is making sure you're up to date so that you're doing it safely and well and to the best, for the best of the patient.
Right. But I do think that if you spin it that way, you're going to have buy-in. Everybody wants to come to work and be the best nurse that they can be. Everybody wants to take the best care of patients that they can possibly take care of. They just need to be shown how.
Yeah, absolutely. And little things make big changes in your practice.
Yeah,
like
absolutely.
A little tidbit of information that you pick up at a class, may completely change your practice and your way of doing things.
Yeah, for sure. Yeah.
So.
And to bring not only your practice, but you're that element of change at your shop right now. You go back to you go to a conference and you get juiced up and you learn something new. Your practice is changing, but you're bringing that tidbit back to your shop and you're teaching your peers about it. So honestly, it's exponential how instrumental you are in change.
Absolutely. You're absolutely right. It ends up being a much bigger deal just by learning some stuff. Change your practice, change your company's practice, change everything.
Yeah. So. I really have to say I'm very blessed that I work for such an amazing organization that is dedicated and passionate about education and professional development. We reimburse for ENA memberships. We reimburse and give stipends for any of our nurses that are certified. We send our nurses to conferences. So they're stuck with me for life.
That's awesome.
It is pretty awesome. I have found my home.
That's great. That's a good feeling.
It is a good feeling.
So
nothing's better than loving what you do, right?
Oh, it makes it so much easier to go to work every day. Because I mean, we have hard jobs, and if you didn't have that payoff of enjoying, one, what you do, and two, who you do it with, then it just becomes a job, and it just it's not as fun.
Yeah.
So
that's the truth.
Yep. So speaking of changing practice, tell me about a patient that changed the way you practice.
I'd have to say again, this was pretty early on in my career. It was, I came to the ER because I loved trauma, right? Blood, guts, and glory, and resuscitation. And that was my passion. That's what draws people to the ER is the fun stuff. And I had this patient who came to my ER. They were cardiac arrest, witnessed cardiac arrest at home. They were intubated in the field en route. So they get to the hospital. We're working them. We're giving it our all. It's total chaotic code. And his wife comes in. The patient's wife comes in, this little old lady with her knitted sweater in the middle of summer. It's 95 degrees out, and she has this little knitted sweater on. And just as calm as can be in this room of chaos says, stop what you're doing. He doesn't want this. He's never wanted this. This is not what he wanted. And I just stopped, and I'm getting goosebumps right now. I got goosebumps at that moment. And I was just taken back. No, we need to save him. We need to bring him back. We have all of this medicine and technology to save him. bring him back. And she just said, stop, as calm and collective as can be. And we ended up, of course, we stopped and we extubated the patient, and I got her a chair and I moved her next to her husband. And she just sat there and held his hand and talked to him while he passed away. And it was such a moment for me, one of the most saddest and inspirational moments in my career. And it really helped me understand the collectiveness, or the whole component of nursing. Nursing isn't just defibrillating somebody and pushing meds. And that's not always best practice to resuscitate somebody. There is a spot for dying with dignity with the people that you love. And that taught me that. And that has stayed with me throughout my whole entire career. And I'm really passionate about palliative care in the emergency department. I was actually just talking to one of our good friends, Andrew Bowman, last night about palliative care in the emergency department. All of his emergency physicians, or not maybe all, but a good portion of his emergency physicians are doing a palliative care rotation. And I was like, that's super exciting and needed in emergency medicine. We just want to save everybody and stimulate them and push meds and do thoracotomies. And that's not always what the patient wants, and that's not always what's best for the patient. And I hope that changes.
Yeah, just because we can do something doesn't necessarily mean we should.
Exactly. Yeah.
So, those patients, man, those will really just touch your soul. Those ones that pass away, you'll never forget them.
Yeah, I mean, here's this little old lady. I think her husband and her were in their 90s. They had been married since high school. I mean, you just couldn't get any more like heartfelt. It was like a Hallmark card. And here she is, just holding his hand, as calm as can be, in the most loving way, just talking about the memories they had throughout their life. And it was just, wow. I mean, it still gives me goosebumps and gets me verklempt. Like it's emotional.
Yeah.
And that's part of nursing, and that's okay. And then that's another part of where we need to move in emergency nursing, is that's okay to feel things. It's okay if something touches you, and it's okay to talk about that.
Yeah. And sometimes we forget that it is okay to talk about that, and sometimes we have to process it.
We need more critical debriefing and burnout relief in emergency nursing. It's so fast paced. We're the one area where you can work this pediatric code for an hour that was unsuccessful, and then bam, you're in the next patient's room teaching a kid how to use crutches.
Yeah.
So fast paced that we never get that opportunity to say, wow, this 3-year-old just died. And I'm bummed out about it, and this is how I feel about it. We need to implement those resources for our nurses and the culture that it's okay to say, hey, that really bothers me. I need some help dealing with this.
Yeah. How do you decompress after like a stressful shift? You have a really tough shift, a really bad ER shift, and a lot of bad things happen. How do you decompress?
I love nature. So hiking, kayaking, anything where I'm alone in the woods or with my family. I'll bring them along, I guess. And of course, my dog.
Gotcha. Got to take the dog. So,
got to take my doggy.
So, yeah, it's sometimes I think people forget that decompress piece, because otherwise it takes a toll on you. Like it becomes like, it just compounds. Like, I'm on my three of 3, and actually 3 of 4, and by the end of 3 rough days, you're just like, oh my gosh, I'm just done.
Right. It's like working the 12-hour shift in a really busy day in the ER working triage.
Yeah.
You love your job when you first walk in. By the end of the day, everybody's a 5.
You're like, you're fine. You're fine. You're fine.
Don't go to fast track or urgent care.
That's right.
And I mean, that's just 12 hours in a busy day in triage. So those 12 hours over a lifetime in emergency nursing build up, and we need to work on debriefing and self-care.
Yeah. Yep, absolutely. Next question I have for you is, have you ever witnessed a miracle in your emergency department?
Yes. Yes, I have.
Tell me about it.
So we had this patient, little old lady. She was passing away, and she asked, the family was at bedside, and they asked to call her husband, who was in a nursing home. And we put them on the phone together, and they died on the phone together.
No, they did not.
Yes.
Oh my gosh.
Like, how crazy is that?
That's
I'm not a very religious person at all, but how do you explain that? It's pretty amazing.
That's amazing. What? Holy cow! What are the odds? I mean, that's something bigger than what you can explain in a textbook.
Yeah.
So, wow, that's crazy.
It's a pretty big miracle. But I think working in the ER, we see these things all of the time. I just went to, I think you spoke about it on a podcast I listened to, the FES conference. And I went last year or this year, and I was speaking to somebody who talks about those miracles in nursing. And I was like, you know what? First of all, that would be an amazing talk, a lecture to see. I would definitely go to that. That was at a conference. But how much we see that in the emergency department, because we see so many people in so many different walks of life, we see these weird things that aren't even possible. Like physics, you can't describe that away with physics. So how is that happening?
Yep. There's no way to explain it. I mean, there's just no, I can't even imagine what it was like to be there in the moment for you, for the family. I just can't even imagine that.
Yeah, it's amazing. And how much that meant to the family. Like, of course, they have just lost. Here's these two children. They have just, I mean, of course, they were grown. They had just lost their mom and dad. But I think knowing that they were on the phone together and they passed at the same time was therapeutic for them. Really? And I got to experience that with them.
Wow, that's cool.
It's those little things that makes our job so great. It's not, of course, do I feel like I deserve a cape when I go in and somebody's tried to get a line in somebody 4 or 5 times and was unsuccessful, and I walk in and I get it the first try? I walk out.
You walk out, I walk out, chest all puffed up, going, I am a badass. Holy cow, I'm awesome.
That's right. Don't trip over my cape as I walk down the hallway. But that's not what makes you a great nurse. It's taking all of those little pieces of spirituality and just those little chunks of emotion that you have gotten over time. That's what makes you a great nurse.
I agree. I couldn't agree more. I mean, that's what this podcast is all about, and that's what being a nurse to me is all about. I mean, the cool trauma saves are awesome, and they're cool stories to tell, and they're, it's a cool experience to have. But something like that, like being there and being there in those incredible moments, someone's first breath, someone's last breath. That's what, to me, being an ER nurse is all about.
Yeah, absolutely. It definitely is a component to making you a great nurse and providing good patient care.
Yeah. What qualities do you need to be a great nurse?
Well, I think you need to be smart. I think that you need to be passionate and engaged. Skills like when I'm interviewing somebody, it doesn't bother me if they don't have a lot of experience with skills or aren't great with skills. I can teach anybody skills. Are you passionate about what you're doing? Do you want to be better than you are today? Do you have those skills? It's personality, it's engagement. That's what I think makes a great nurse.
I agree. I think that's, if you can get that, then you're right. We can teach you the skills. I can teach a monkey how to start an IV.
Yeah.
But I can't teach a monkey how to care about people.
Yeah. And negativity, like, stop the drama. We're not in high school anymore.
Yeah.
Stop it. Who cares? Like, I don't care if Becky has a big butt or, if somebody made a mistake. We don't need to talk about that mistake again and again and again and create a toxic work environment. Nobody cares. Nobody should care. If you think that there's a problem or a patient safety issue, address it with your managers, address it with your educator, and let them handle it. Stop the negativity.
Yeah. How do you deal with bullying in the workplace?
I don't tolerate it at all. I'm really passionate about that. I think that we, 100% in emergency nursing, is guilty of, eating their young. We need to just totally cut it right out. We need to call each other out on it every time we see it, every day. We wouldn't allow somebody to treat us that way outside of work, and we wouldn't allow somebody to treat another person like that outside of work. Why do we allow it in work? It absolutely has to stop, and I immediately call somebody out on it. And I am, again, lucky that I work in an organization that has zero tolerance for bullying or negative behaviors.
That's awesome.
And so everybody in management and admin is very supportive, has open door policies. And if somebody is being just downright mean to somebody, it is absolutely not tolerated. And I'm proud to work for an organization that has that culture.
That's awesome.
It is awesome.
That's what you
want.
Yeah, that's exactly what you want. You want, because it takes an organization to say, hey, we're not going to tolerate this.
And then again, yes, we need the organization and admin to have that support, but we as emergency nurses need to stand up and say, this is ridiculous. We're never going to move our profession where it needs to be, where it can be, having these attitudes.
Absolutely.
Stand up for just being a nice person.
You're right. You're absolutely right. So, what's the best advice a nurse mentor ever gave you?
Keep trying. Keep trying. Tomorrow you're going to be a better person. Never give up. Just keep going. Get yourself up. You're going to get knocked down. People are going to say mean, hurtful things to you. You're going to fail a lot. You're going to do something wrong a lot. Just keep plugging at it. And with practice and time, you will be better.
What's the worst advice anyone ever gave you?
The worst advice. I think that's given a lot. You're doing it wrong because this is the way we've always done it.
Oh, I hate that.
It makes me explode. That is never an acceptable reason. And if that is what you're using for a reason, you need to know the why. And is there a better way? So I wish that all emergency nurses would drop that from their vocabulary.
For sure. That's one of those things that you're like, no, that's never the right answer.
That's never the right answer.
So the last question I have for you is a question that I call 3 things. So what I'm going to ask you is, what are 3 things a new ER nurse should always remember? And what are 3 things a new ER nurse should just go ahead and forget?
So 3 things an ER nurse should always remember is to love his or herself. Self-care is so important. And to have a work-life balance. There's always going to be opportunities to pick up shifts, but there's not opportunities for that missed time with family and friends.
Yeah.
So self-care is one of them. The other one is join ENA, get certified, continue your professional advancement. You are going to be a better nurse tomorrow, and keep looking for that tomorrow. Keep reaching for that better nurse that's within you. Constantly improve upon yourself. And I am an advocate of joining your National Professional Association, getting certified, reaching and attaining those professional development goals. And third, just don't take it home with you. You're going to make mistakes. It is inevitable. There is not one nurse on this planet, regardless of how great you think he or she is, that hasn't made multiple errors and mistakes and hasn't been frustrated or hasn't cried on the way home from work. Brush it off, get back up, and do it again.
Yeah.
And what do they need to forget? They need to forget all of the negativity that is thrown on them. They need to forget this is the way we've always done it. I'll say that again because it's so important. And they need to forget any kind of bias that we're not one team. I think it was Kelly Grayson who said, it doesn't matter what uniform you're wearing, it's your attitude. And don't forget your clinical assistants. Don't forget EMTs or paramedics. Don't forget that the ICU nurse, we are all on one team with one goal. And the quicker that person, you're as a nurse, you realize that, the better you're going to be as a nurse.
For sure. I think it's you sometimes forget that the other people around you are still part of your team, whether they're in the ICU or came off the truck and brought the patient in. They all have value and they all have their place, and
absolutely,
it's an important place. Everyone has an important role to play. Certainly we can't do it all, nor would we want to. So it's important to remember those people that are also part of your team, if not, the people you show up and work with side by side for 12 hours.
Right. Mm-hmm. Yeah.
We're
all a piece of that pie that makes great patient care.
Absolutely. So if someone comes up to you and says, tell me a funny story that happened to you in the emergency department, what's your go-to funny story?
Oh gosh. I say that I've made so many mistakes that telling people about my mistakes will make them great nurses, as I've learned. But probably the funniest thing was with this preceptor who then became my best friend, Vicki Granger. It was just a hot mess of a crazy day in the ER. And so she was like, go in there and get some blood cultures on this patient and put a line lab and get some blood cultures. So I go in, put a line in, miss the patient the first time, and they have the most amazing veins ever that you could hit from the parking lot. So then I have to suck it up and try again. End up not putting enough pressure when I started the IV. That blood was just everywhere. It looked like a massacre. I draw the blood cultures. Everything's fine. Pick up my mess. Walk out of the room. Drop the blood cultures. They smash all over the floor.
Oh no!
Have to pick those up. Draw a new set of blood cultures. Then I tube that our tube system, and I put too much in the tube system, and it exploded in the tube system.
Oh
and
no!
Shut down the tube system for the entire day. So that's pretty much my worst case scenario day. And at the end of the day, her and I went and had a drink together after work, and she was like, I'm just an inch high. How could I have messed all of this stuff up? I literally shut down the tube system for the hospital today. And, she just was so wonderful about it. Just things happen. Granted, I've never seen all of these things happen ever.
Yeah, usually not all at once.
They happen. And from there, we became best friends.
That's awesome. That's fantastic to be able to end up. Yeah, it's cool when your work friends end up becoming your true friends, your best friends.
Oh yeah, she's my person now for sure. She's who I still call after a rough day to just emotionally vomit the day's negativity away.
Everybody needs somebody for that. So
yeah, absolutely,
for sure. Anything else you wanted to cover that we haven't talked about so far?
No, I think it's been an amazing time. It's been a great chat.
This has been good. Holy cow. This is really good.
Yeah.
So
Yeah, this is great. I keep doing what you're doing. I think that you're touching the lives of so many people and really forming nurses, really helping them understand the importance of the art of nursing.
that's my goal. That's the goal right there.
Thanks for listening to the Art of Emergency Nursing podcast. Make sure to subscribe to the podcast and follow us on Facebook.